I'm Dr. Art Mollen.
And I'm Olivia Fierro.
Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. I'm Dr. Art Mollen.
And I'm Olivia Fierro.
And we hope you're feeling good, but we're going to motivate you, educate you, and even advocate for you.
I look forward to sitting down with you, Dr. Art Mollen, every single time because you've got such expertise and information that we can all benefit from. So let's get right to it.
Well, thank you very much. We're going to try to anti-age at first.
Oh, yeah, please. I'm all ears on that topic. The peptides. I mean, the word peptide could be the hottest word, of the last several years, right?
That's the buzzword right now. No question about it. Everybody wants to take these peptides because they've heard that they're going to promote anti-aging. So first of all, let's explain what peptides are.
Please.
Peptides are basically amino acids. So amino acids are the building blocks of protein. So they're not necessarily complete protein, but these peptides, they can have anywhere from 2 to 50 of these amino acids on them. And so because they're smaller, they are absorbed into the body pretty readily. And so they can boost your metabolism. They can reduce your body fat. They can basically increase your energy level. They can increase stamina. So there's some effects to it that actually seems to be beneficial, but they have to be injected. So the pills that they have and the creams that they have, these peptides don't necessarily work. In fact, the scientific evidence, suggests a lot of these creams and oils and things that may contain peptides, and you rub them on and they may plump up your skin a little bit, but they are very, very temporary. They're not anything that's going to be long lasting. So it's not like the peptides that are actually being injected, which can be quite expensive. So you have to look around to find out if they're legitimate or not in terms of the peptides that they're actually injecting.
And primarily we hear about people going to get these, of course, as a weight loss fix, but is the anti-aging enhancement kind of one of those things that they discover along the way?
Yeah, so they have found that basically, again, because it can improve your skin tone and can take away some of the fine wrinkles that you may have and promote collagen, so that's the undersurface of your skin. So some of those effects from the peptides can be beneficial. It increase your metabolism, so you're certainly going to lose some weight. But how much weight do you really lose? Well, we don't know for sure. So it's been noted that the peptides can work almost immediately within the first several days that you actually have these injections. But on the other side of the coin, it could take 3 to 6 months before you actually notice any weight loss from them. So as far as the weight loss, and if you're into the anti-aging, you may want to take some of the semaglutides, which are the other hot buzzword out there.
I think I'm conflating the two. So I want both semaglutides and peptides, apparently.
Right. And some
Where do we go for these peptides?
Yeah, well, some people are taking peptides with metformin, and I can talk about that later. But the metformin is something that's used for diabetes, and it has shown to be anti-inflammatory and also promote some weight loss. So metformin is a prescription medication that people often take for diabetes, but that is not a peptide. The peptides are a separate entity unto themselves.
Fascinating. Okay, Dr. Mollen, we have a question, or we want to tackle the topic of shingles and misconceptions about shingles. I mean, we see a lot of the commercials about making sure that you get the vaccine against shingles, and it seems like it's pretty scary.
Well, shingles can be one of the most misdiagnoses of the year because a lot of times people don't realize that they have shingles. They may have simply pain and they don't have any lesions. So the pathognomonic signs of shingles, basically clinically, when we say pathognomonic, means these are the classic symptoms of that particular disease. And they're usually one-sided. So it's on one side of the body, doesn't cross over. Very, very seldom have I seen shingles actually cross over. So it can be on your chest, it can be on your abdomen, it can be on your hip, on your leg, it can even be on your arm, and it can be on your face. And if you get it on your face and it's close to your eye, that's when you absolutely need to see an ophthalmologist because it can potentially cause blindness if you were to get the shingles on your face. So why do people get it? It seems like stress. It seems like sunlight. It's when their immune system is compromised. So shingles is an exacerbation of the chickenpox virus that lies dormant in your spine. So people often worry, is it contagious? It's contagious to a small infant who has not received the varicella, which is known as the chickenpox virus, when they have not received that. So it can be contagious to them. But for others who basically have had chickenpox sometime during their lifetime, then it's not going to be contagious to them.
And it's often misdiagnosed amongst those people who maybe don't show the lesions, but have the other
exactly
symptoms. Okay.
Because they haven't had the lesions, and people, could be mistaken for, acne. It turns up as like little blisters. It's similar to herpes virus.
Okay.
Again, because it's in that same family. So I think what's important is if you were to get it, to get a prescription for Valtrex, acyclovir, Zovir. These are medications that basically can reduce the exacerbation of it and the symptoms of it, so it doesn't become quite as severe. So there are treatments for it, but again, stress is one of the major factors. And if you've ever had shingles, you know that stress really causes a flare-up.
Stress ruins everything, right? It is one of our...
the killer of man.
It really is. It really is. And it kind of leads us to the next topic we wanted to discuss, which is, about some over-the-counter remedies and, what are often abused in different medications. And of course, I know if it were up to you, the prescription would always be go out for a run, go get some exercise.
Right, exactly. But over-the-counter remedies can be abused. So the three that are most often abused are dextromethorphan, Robitussin, and because it affects your central nervous system, so it suppresses your central nervous system. So if you take too much of it, it can potentially be dangerous. So you have to be very, very careful of that. Another one that's often abused is, and I've seen it, is Imodium, which is taken for diarrhea. And because it does that, it slows down everything in your body. So you can have dizziness, you can have lightheadedness, and if you take too much of that, then that can certainly be a consequence of that. And then the final one is Sudafed, and Sudafed is basically the same type of thing of an amphetamine, so methamphetamine, they use Sudafed to make methamphetamine. So it's a stimulant. And if you take too much of it, it can potentially be dangerous. And that's why in recent years, you see it under lock and key at the pharmacy, or it's behind the pharmacist. It's not out in the open where people could just load up and then take it home, boil it down, and then the next thing you know, they're making methamphetamine in their garage. So, the problem is those three you have to be very, very careful of. But there are a lot of other common over-the-counter medications, not necessarily the ones that are most abused, but it includes the acetaminophen, the ibuprofens, the Claritin, Pepto-Bismol, which is another one that people, will take when they have an upset stomach, and some, nausea, vomiting, diarrhea, Dulcolax, which they take as a laxative. They want to lose weight, so they'll take some, Dulcolax and things like that. The Dramamine, which they take for dizziness. So those are some that can really be abused. But again, it's back to the Robitussin, the Sudafed, and the Imodium, which I think are the three most abused.
Wow.
So be careful.
Be careful. Just because you're able to just get it without a prescription
doesn't.
Take
it as prescribed on the label.
Right. And I guess there's got to be kind of a benchmark where you say, if I'm taking an over-the-counter medication X number of times a week, all consistently, there's a broader issue, right?
Exactly. And go to see your doctor, get it evaluated, see what you're treating yourself for, because I've seen patients over the years treating themselves for 3 to 6 months with over-the-counter remedies, and they wind up having an underlying cancer or something more serious.
All right. Doctor, some great information today, and we have some questions coming up. So it's just about clinic time.
I think we better go into the clinic, and it's time for my white coat.
We'll make sure you're feeling good.
Okay. Well, we're back in the clinic. I'm ready to listen to my patients.
Yes, the doctor is in and he has time for you. So let's begin with Jessie, who is 29 years old. And Dr. Mollen wants to know a little bit about your take on being a part of a clinical study. She's been diagnosed with depression, and, this would be an opportunity to maybe try a new medication.
Yeah, so there's a lot of studies out there that really focus on depression. A lot of clinical trials out there. Years ago, I was involved in a lot of the clinical trials on some of the antidepressant medications. So I think those particular trials can be beneficial if conventional medicine and the medicine that's being prescribed by your physician presently is not being very beneficial. So if it's not helping, it's not working, you want to try something else, then it's fine to enlist in a clinical trial. However, make sure that the clinical trial is a level 3 clinical trial, that it's being used, on other people. Ask questions. Ask, is it helping them? Have these patients improved? Most of these clinical trials are double-blind studies. So basically, you don't know whether you're getting the real medication or you're getting a placebo. And the physician who's overseeing it, they don't know either whether or not you are getting the actual medication. So, and especially with depression medications, sometimes a placebo effect can help more than anything else. So I would say clinical trials are good, but just investigate and make sure that the clinical trial you're involved in is a legitimate one and that there are patients who are getting some benefits.
Could be dangerous if something was working for you and you were removing that and replacing.
And again, only if the conventional medication that you've been taking has not been satisfactory.
Okay, very good perspective. Dana is 36 years old and wants to know what a lot of us want to know, which is, trying to lose weight. What's the threshold for caloric intake? What's safe? How low can you go?
Sure. So if you're on a diet, be careful not to go on an ultra low calorie diet. If you go down to one of these diets, which are 500 calories or less, your body's not going to be burning any calories. So your body is much like a furnace where you have to put calories in to get the flame to go up. And so if you lower that, then your body's going to really come down to a slow metabolic rate, and it may be very, very difficult. So I don't suggest taking less than 1,000 calories a day in order to keep that metabolism going.
And once that rate changes, it doesn't necessarily go back to normal when you...
No, because your body could develop a new set point. And the set points, that's a whole separate discussion for us at a later date. But, our body does have a certain set point where, it's very difficult to break through that particular weight level.
Richard wants to ask you about experiencing neuropathy in the hands and feet and wants to know if it could be associated with vitamin B levels.
So there's several vitamin Bs that are very beneficial. There's pyridoxine, there's folic acid, there's vitamin B12, there's niacin. So these are the vitamins that fall into the class 3, 6, B9, B12. That's where they are. So vitamin deficiencies are very, very rare when it comes to B vitamins, unless you have an iron deficiency, anemia, and you have some other underlying disorders. So I think with vitamin deficiencies, you want to have your vitamin level checked before you start taking it, and particularly taking it for a neuropathy which is basically pain and discomfort, maybe in the feet or something. And people often think maybe I have diabetes. So, get your sugar levels checked, make sure it's not coming from diabetes. And then also neuropathies can come from low back pain that can be radiating down.
If I remember correctly, vitamin B family is the only supplement that you say
I think vitamin B is good because it's a water-soluble vitamin, so you can't really take too much of it. It'll get washed out. Vitamin B and vitamin C, as opposed to vitamin A, D, and E, which are fat-solubles. You have a good memory.
It's the vitamin B. Wait, I don't know.
That B12 I've been giving you is helping.
Exactly. It's the peptides I really need, though. Let's go there. Vivian.
Don't have any with me.
Now, that would be a good episode. Okay, we're injecting peptides right now. We're going to see what happens.
We can use Botox, though.
Yes, please. I'll let you practice with that as well.
Injection.
Vivian wants to know if there's a natural remedy for nail fungus?
So I like natural remedies for nail fungus as opposed to the prescription. The prescription medication they use for that is called Lamisil. And Lamisil is a medication, and you take it by mouth, but it can cause blood dyscrasia. So a lot of times doctors don't like to prescribe it because of the potential changes in your blood that can occur due to taking a medication like an antifungal on a regular basis. So one of the things we suggest is tea tree oil. Tea tree oil is something you actually paint on the nail. Another prescription medication for nail fungus is called Penlac. That's Penlac. So you can take something like that and paint it on the nail, and that actually gets rid of the nail fungus, but they don't go away immediately. It could be 3 or 4 months before it goes away. Now, one alternative is to go to see a podiatrist, and they can remove the nail and treat the nail bed, so hopefully they give you some anesthesia before they start removing the nail. But that is one recommendation as well.
It depends on, is it sandal weather? How quickly do you need this fixed, I guess, right?
right. Yeah,
if you're in the Ugg boots, nobody has to look.
Tea tree oil will work, yep.
Okay, good to know. JJ writes in and wants to know, and this is probably one of the most useful questions I would say we've ever had, asking you really if there's a difference between generic prescriptions and brand name prescriptions. Of course, budget being top of mind for so many folks.
Yeah, no question about it. So brand names are, certainly something you want to try to get if you can. But if they're giving you a generic medication, most of those work, and most of them are just as effective. It depends. If it's a heart medication, if it's a blood pressure medication, make sure that you're not having any additional side effects from it. Make sure that it's being as efficacious as the actual brand name was. So if it's not going to be as effective, then that's something that you'd want to go back to the pharmacist. So what happens with some of the alternatives, remedies, basically the generic remedies, is they use fillers. So sometimes the filler that they're actually using in that medication, that can be a little bit different from manufacturer to manufacturer. So you want to go to your pharmacist, ask them who the manufacturer is, and make sure that it's somewhere close to what they were giving you before, to make sure you're not having any other side effects. But when you take the generics, usually they're just as good, and they are usually less expensive.
Yes. Okay. Because you hear just heartbreaking stories about people kind of deciding which prescription medication to skip over because of budget. And so have a conversation with the doctor if a good generic alternative is available. Okay. Great questions for this episode. We also have some great questions coming in from family medicine time, because they've got a doctor in the family and we want answers.
I think the family was on the hyperactivity I think I'm going to have to start prescribing ADHD medications for my family, because they were on overload this week. I mean, it wasn't the usual, one question a day. It was like they were just blasting me, like 5 questions, boom, boom, boom. I mean, they were on overload this week. So I'm going to have to start medicating my family.
Or at least yourself.
Yeah, or I'm going to have to take medication myself just to reduce the anxiety.
You can only run so much. So, we're really coming in hot at Dr. Mollen.
Right.
Let's begin with Samantha. Samantha needs to know, do I need to take medications for high cholesterol?
Well, her cholesterol was 220, which is a little bit high. She's in her 40s. I think 220 is a reasonable rate. That's something that can be corrected, again, with exercise and diet. She's an exercise fanatic and eats quite well. Her LDL level, which was 120, so I'd like to see that down to 70, and I like to see generally cholesterol's down to about 150. So if we can work on that and use exercise and diet at the age of 40, I don't recommend that she start taking any cholesterol medication.
And the LDL is the bad cholesterol.
LDL is the bad cholesterol. Okay. So the HDL is the good cholesterol. You want to keep that, again, try to get that up over 70. And the LDL, you want to kind of keep that down below 70.
Okay. And what causes a change like that?
What causes it?
Yeah. I mean, if someone's relatively healthy, they're exercising, they're doing the right things, some of it is just...
It's genetics.
It's genetics. It's your fault.
Right. So...
Family medicine. It's Dr. Mullen's fault.
I would say it's genetics. And of course, it's important to pick the right parents. And so I would have to say that let's blame it on our mother and not the father.
There we go. Oh, yes. If only we were picking our parents, so many things would be different.
My cholesterol's good. So that was the first thing I told her.
Don't look at me.
And I sent her my lab work. I said, here, look at my labs. And she's like, I'm jealous.
That's amazing. Okay, Stacy is asking about metformin, which we've talked about as a diabetes medication, and also some of the other related.
So metformin works quite well as an anti-inflammatory. In recent years, they've suggested it could be actually anti-aging because of its anti-inflammatory benefits. It's been the gold standard for the treatment of diabetes for many years. Recently, semaglutides have kind of taken over that position, but there's another anti-aging medication that's out there. It's called rapamycin. So rapamycin is a medication, and it's quite expensive. For 100 tablets is about $1,800. So that's something that people have been taking as anti-aging, and that has a tremendous anti-inflammatory effect. But in recent years, they've realized that it actually can trigger diabetes because it offsets your blood sugar. And so you have to be careful with this rapamycin, which is another type of anti-aging medication that they're touting out there. But the metformin works well, and you could potentially take it, but you have to monitor your blood sugar because it can potentially lower your blood sugar too low, particularly if you don't have any family history of diabetes and you haven't been having an elevated, what we call hemoglobin A1C, and that's a test you can get at your doctor's office, and it measures what your blood sugar has been doing over the last 3 months. So hemoglobin A1C, it's a very good test for people to get. If you go to your doctor's office and you have routine blood tests, make sure they test that because that will show if you either have diabetes or have a propensity to develop diabetes in the future.
And even when you're in that pre-diabetic
stage, it'll show, it'll come out as an elevated test. So the normal should be somewhere around 5.5, 5.6. If it elevates above 5.7, then you are going into the pre-diabetic stage.
And once you're on that trajectory, it's not inevitable. It's not like you're definitely going to become diabetic. You can make
there's no question about it.
Right?
If you have, again, a family history of diabetes, then you have to be very careful.
Okay.
If you developed a high blood sugar during pregnancy, then that means you probably have an increased proclivity to develop diabetes in the future.
Okay. Our next one is from Francine, and Francine is dealing with fever blisters. And so what's the deal with that? What are we going to do?
Yeah, so fever blisters, again, are so very common. And, people get fever blisters, when you're a child or something, your aunt, your uncle, your grandmother, they'll kiss you on the lips or whatever, and they may have a fever blister or something, and they don't realize that they're actually transmitting it to you. So I think as an adult, if you start to get recurrent fever blisters, you want to get a prescription for Voltrex or acyclovir or Zovirex, one of these types of medications which are antiviral. And if you take it immediately, Voltrex, you could take 500 milligrams up to 1,000 milligrams, and you take that dosage and take it immediately, upon contracting it, it'll suppress that within a 24 to 48 hour period.
And that's probably something that it gets more flared up the more stressed out you are about it, right?
Exactly. So you can get those all the time. Yeah,
you feel like it's coming on, then you're stressed about it, then it's definitely coming on.
And my family gets everything. So what can I tell you?
Well, that's great. It's great for our conversations.
It'd be great for business if they paid.
If only.
They're not a paying family.
Luckily, family medicine is free, but it's free for us, and we benefit as well. So, Dr. Art Mollen, thank you so much, and thanks to the family for all the great topics.
It's great to be here with you, Olivia.
We hope you're feeling good, no matter how we're looking, good or bad. But if you have questions, we want to talk about it, and we want to give you some answers with Dr. Art Mollen. So email us at askdrartmollen@gmail.com.
And I hope you're feeling good, and we'll see you next week.